Aesthetic medicine is a rapidly expanding cash pay sector, attracting everyone from general practitioners to specialized surgical experts. Expanding into clinical cosmetology requires a deliberate business choice regarding your facility, equipment, and legal scope. You could begin with a low-risk foundation, focusing on surface-level skin rejuvenation and basic wellness treatments. A more capital-intensive path involves investing in high-end energy-based devices for deeper clinical results. The most technical path moves into invasive injectables and hair transplantation, where the liability increases alongside the potential ROI. This progression is organized into 3 tiers: Level 1 for basic rejuvenation, Level 2 for advanced devices, and Level 3 for advanced medical aesthetics. Choosing the wrong starting point carries a high price. You may end up with expensive machines that sit idle, or procedural risks that your primary license wasn't designed to cover. In the Indian market, your clinical boundaries are defined by your primary degree and the resulting scope of practice. Aesthetic training provides practical skills. It does not replace a university degree or grant an independent license. Note the warning on Level 3. Injectables and transplants are strictly governed by your primary medical qualification. A surgical specialist or dermatologist has a different baseline of legal clearance compared to a general practitioner. Training is only a viable asset if the procedures you learn fall within the guidelines of your respective medical council. We can evaluate these paths using this comparison matrix, starting with the Level 1 clinical cosmetology baseline. The training inputs focus on skin anatomy, PRP therapy, and high-demand medical facials, like the hydrofacial or vampire facial. Device training at this level is relatively accessible, covering IPL and diode lasers for hair reduction. The outcome is a clinic that can immediately offer recognizable, high-turnover services to a wide patient demographic. However, this accessibility creates a specific economic pressure for the practitioner. Because the barrier to entry is low, Level 1 services are often commoditized, requiring high patient volume to sustain profitable margins. Practice growth accelerates rapidly when transitioning from surface treatments to deploying high-intensity, energy-based devices for structural skin modification. Adding Level 2 to our matrix shows a significant shift in both capital and clinical focus. This path requires heavy investment, like CO2 lasers and HIFU systems, and microneedling radiofrequency devices. Clinical training expands to include thread lifts, advanced medifacials, and complex rejuvenation combinations. The outcome is the ability to charge premium prices for high-ticket, non-surgical procedures, like deep tattoo removal or skin tightening. The trade-off is the complexity of managing complications, specifically laser-induced burns or post-inflammatory hyperpigmentation. Level 2 trades surgical risk for financial risk. The clinic must maintain consistent marketing to recover the high cost of the equipment. Finally, Level 3 represents the pinnacle of aesthetic medicine, where the primary investment moves from hardware to clinical mastery. This level involves a rigorous study of facial anatomy in order to safely administer botulinum toxin and dermal fillers. It also includes the technical protocols for hair transplantation, the most invasive procedure in this progression. The outcome is the highest possible profit margin, driven by patient results that rely entirely on your personal skill rather than a machine. The trade-off is clinical risk. Complications at this level, such as vascular occlusion or localized necrosis, require expert management and carry significant liability. Level 3 offers the strongest ROI, provided your primary medical license allows you to legally perform these invasive techniques. To find your best fit, we can plot these levels on a quadrant chart, comparing capital investment against clinical liability. An entry-level practitioner usually fits in the bottom left quadrant. For this profile, the focus should be on building a stable revenue base through low-risk treatments like metafacials before attempting to scale. A clinic builder with access to capital maps to the bottom right quadrant. This path utilizes HIFU and CO2 lasers to create a premium practice identity without entering the high-liability territory of surgery. Specialists, such as dermatologists and plastic surgeons, are positioned in the top half quadrants. These practitioners can use their foundational anatomical knowledge to master Level 3 procedures, allowing them to offer complex, skill-based treatments with high profit margins. Success in aesthetics is not about finding a single correct level, but about matching your training to your budget and your existing medical degree. Legitimate training platforms exist to empower doctors through evidence-based protocols and proactive complication management. Every procedure you perform must remain within the legal framework established by Indian regulatory authorities. A sustainable practice is built on the rigorous mastery of the specific procedures that fall perfectly within your legal scope of practice.